I'm going to introduce now Dr. Meydani, who's going to do a moderated discussion. Thank you. Dr. Meydani, Simin Meydani, has served as the director of the Jean Mayer Human Nutrition Research Center on Aging, that's a USDA, one of the USDA centers since 2009, and she's currently transitioning to the position of Vice Provost for Research at Tufts. She's a professor of nutrition there and also of immunology at the Friedman School of Nutrition Science and Policy, and also at the Sackler graduate program in immunology. Her interests include the impact of nutrition on aging and age-related diseases, and the role of nutrition on immune and inflammatory responses and predispositions to infectious disease. And we're delighted to have her soon to be joined by her panel on healthy aging. What is it? Are there acceptable markers to utilize in developing strategies to promote it? Simin.
Thank you so much. So what I'd like to do is to start by giving some of my own thoughts about what is healthy aging, which has been informed by the discussions that we've had so far. And then I'm going to ask our panel, distinguished panel, to come up, and then they're each going to spend about 5 minutes or so talking about the ideas that they have about that, and then we're going to open it to discussion and hear from you. So hopefully this will be a very interactive session. So that's it. So we've seen a lot of wonderful statistics, which I think has been very important in terms of setting the expectation for this meeting. But one statistic that I want to share with you, which I think is very important, is that we have in 1930s, for every retiree, we had about 16 people who were working. But in 2030, we're going to have only about 2.2 working people for any retiree. So you can see the burden that this could have in terms of the society and why that is important. And again, you've seen a lot of these statistics, but just to put things in perspective for you, this is some of the costs that is associated with the care of the chronic diseases that are associated with aging, as well as for the infectious diseases. So because of that, then it becomes very important for us to develop strategies that can promote healthy and active aging and expand the health span of older people rather than the lifespan. But one and I guess to sort of understand how we can go about developing these strategies, it's important to understand how successful aging, what leads to successful aging. And if you think about it, there's obviously the genetic background, then there's the rate of aging and diseases that can all work together to determine who can successfully age. And in terms of factors that can impact the rate of aging, I mean, we've heard both in terms of lifestyle and environment. And when it comes to lifestyle, obviously a very important factor in this whole, and this slide is just basically putting everything together. It's your genetics, it's the lifestyle, it's the environment that can determine both the rate of aging as well as the susceptibility to diseases, and that can determine longevity and health span. And in terms of factors that are important in terms of lifestyle is obviously nutrition, exercise that we have heard about, other lifestyle factors such as smoking, and what I want to emphasize is the psychosocial aspects of interactions that is becoming more and more important in terms of determining the successful aging and the quality of life for older adults, something that we haven't paid attention to before. So in order for us to develop strategies to promote healthy aging, it's very important to know what healthy aging is. And that's, and that's where we run into some problem, because there's not real good consensus, as you might have sensed throughout the meeting yesterday, on what exactly defines healthy aging. And hopefully we can have some good discussions about that and what are some of the essential components of that. So early definition of successful aging were really focused on absence of diseases, and so they were more focused on negative attributes of aging rather than the positive attributes, but today we do understand that healthy aging is not synonymous with lack of aging. There are a lot of other factors, lack of diseases. There are a lot of other factors that contribute to that, and we would, I'll go over some of that shortly. So one of the first people who tried to get at this concept of successful aging is not just lack of diseases are Rowe and Kahn, which based on the MacArthur Research Network of Successful Aging. They describe successful aging as involving freedom from disability along with high cognitive, physical, and social functioning. And that's one of the first times that this concept of social functioning and other cognitive functioning and so forth came into play. And then they sort of talked about 3 different domains in terms of healthy aging, which is freedom from disease and disability, high cognitive and physical functioning, social and productive engagement, and then later on they added the concept of resilience, which is the ability to adapt to changes that occur in life, and that adaptability, both in terms of at the cellular and molecular level and at the social level, becomes very important in terms of successful aging. So one of the studies that tried to look at this and come up with some index of successful aging is a study that was done in the Mediterranean basin. And basically, this study, they enrolled about 2,600 elderly who were about age 65 to 100 years from these areas in the Mediterranean islands. And what they tried to do was to look at a multi-dimensional domain in terms of successful aging. So they looked at probability of disease, cognitive and physical capabilities, active participation through social activities. And the idea was that multi-domain approach to defining successful aging is going to provide us with much better information than just looking at it from one point of view or other. So in doing that, they came up with a 10 score or 10 item index for successful aging. And you can see some of the areas that they have focused on, many of which was mentioned throughout the talks that we had the day before, and they do include both physical as well as psychosocial measures of successful aging. When they did that, what they found was that for every 10th unit increase in, and let me sort of step back and say that this was, the score was from 1 to 10. And so for what they found was that from every 1/10th unit increase in the successful aging index, there was about 20% less time that a person used in terms of using the healthcare services or seeking consultation within a 1-year period. So I think that's very important because, I mean, if you can get a 20% reduction in healthcare use with improvement in this measure, that could be a very useful way of looking at developing strategies in terms of successful aging. So, and this is just to show you that when they looked at different contributors to successful aging, you can see that lifestyle factors accounted for about 48% of the variance in terms of being successfully aging, and then, of course, lack of diseases. And some of the economic factors and educational factors were not as important. So I think that's important to keep in mind. Now, there's also been other attempts to try to see, are there ways that we can find, because there have been a lot of studies that have used different definition of successful aging. So trying to find common threads between them. Depp and Jess, they looked at several different studies, 28 different studies, which were mostly independently living older people. And when they looked at percent of successful agers, you can see that there's a real range of, based on this study, the percent of successful ager changes. And a lot of it has to do with how successful aging was defined, who did they compare them with, and whether they included negative or positive attributes. But what I want to also point to you that these two darker columns are definitions are sort of self-reported successful aging by older people, and you can see that they're much higher than what the physicians or healthcare healthcare professionals define them. So I think that becomes important in terms of understanding, you know, in terms of who should really be defining successful aging. Should it have input from the older people themselves or not, and taking into account other factors. And in doing that, Young has come up with 3 different domains of psychosocial, social, and then psychological domains in terms of defining successful aging. And this is, I think, very important and does link with nutrition, because what this is that they looked at the sort of change in performance in terms of cognitive function, starting at different ages, and then looking at people who had excessive social connections or average or limited. And you can see that the decline in cognitive function is much sharper and comes faster in people who have limited social engagement. And I think that is an important thing to keep in mind in terms of social interactions and the opportunities that it would provide in terms of food and nutrition, because we can certainly combine provision of healthy food with social interactions that would provide the opportunity to take advantage of this benefit. So I think that when they did that, it seems like that having the effect of reducing sort of being connected to social group had the effect of reducing the cognitive age of an 80 years old by 9.5 years. And I think that's very important. I mean, we have many opportunities for delivery of food that can be combined with social interactions. So finally, I think that not to sort of belabor this point, but social relationship does become important. And I want to finish by saying that there are different ways of defining successful aging. There's objective definitions and there are subjective definitions. And I think we know more about the objective definitions and a lot less about the subjective definitions. And if you look at it, most older people might not meet the objective definitions of successful aging, but they do meet the subjective measures. And when you look at it, actually, from the point of view of the older adults, you can see that these are the important factors for them rather than absence of disease. And those are things that we need to be keeping in mind. So, you know, the question that I posed before, who should really be defining successful aging? So to conclude, I think that the definition has certainly evolved for the better over the last 50 years, and now it includes both the psychosocial aspects of aging as well as the biological and some of the physiological aspects of aging. And what is important is to understand which components of these definitions are important and also who should be defining them. And but when we look across all the different definitions, we can still see that high physical activity, cognitive and social function engagement is the common thread that is found among all of the definitions. And from some of the discussions that we have, I like to add the taste and smell, oral health and microbiome. We know a lot more about oral health and taste and smell and its role in terms of successful aging, and a lot less about the microbiome. And what I would like to pose is that what are the biological markers of these physical, cognitive, and social domains of successful aging, and how are they related to diet and nutrition? And I hope that the panel discussions and the input from you would address some of these questions. So now I'd like to invite thank you.